Good evening and welcome to tonight's webinar. My name is Sophie McMurray and I'll be chairing for tonight. Before I go on to introduce our speaker, I'd just like to say a massive thank you to Feline Friends for sponsoring tonight's webinar. And if you would like to ask any questions, just hover over the toolbar. It might be at the top or the bottom of your screen, depending where yours is. Click the Q&A box and you can send your questions through to me so that I can ask Ian at the end. Okay, so tonight we have the wonderful Ian Ramsey. Ian is a Professor of Small Animal Medicine at Glasgow University and an RCVS and European recognised specialist in small animal medicine. He has lectured and published extensively on many aspects of small animal medicine, but his main interest is endocrinology. He's the editor of the BSAVA Canine and Feline Formulary and was awarded the BSAVA Woodrow Award for contributions to small animal medicine in 2015. Over to you, Ian.
Thank you very much. Welcome everyone to this webinar on feline infectious diseases, what your cat needs you to know. And although I do a lot of endocrinology now, I actually did start my career at the University of Glasgow working on feline infectious diseases, some of the retroviruses in particular. So I have a long association with this topic, and it really is one of the more exciting and interesting topics from an historical perspective, as well as of immediate concern to cat owners everywhere. So what are we going to do? Well, first of all, I thought what we'd like to do is let's just stop and think about feline infectious diseases in the wider context. If you look at those infections that are specific to cats, then there is a huge list. These individual variations and unique infections of cats fill whole textbooks. And that begs the question then, is there something wrong with cats? Are they prone to infections? Is there something that makes them susceptible? Well, the answer is no. There is nothing wrong with cats. The thing is that cats have evolved to be sociable animals. Some of you might find that difficult to believe. Some cats are somewhat antisocial to other cats, but that's because they have evolved to be and live in small, stable groups, which are formed when the cats are very young. If those cats are brought together when they're older, they're unlikely to form that small, stable group. Now, within that context of the small, stable, family-orientated group, then infections can spread quite rapidly and easily. But it only stays in the group because they don't spread group to group that easily. Where we get the problem is when human beings get involved and we start to bring cats together into much larger groups than they would ordinarily occupy. And the density of animals in those groups can be very, very high indeed. A family group of cats may have a territory of an acre or more. And if we then take 12 families of cats as family-sized units and we put them all into one house, that's a very high density of animals. And as a result of that, then the infections can spread more readily. And the second problem is that feline infections tend to be chronic. They tend to live with their viruses for a long time, and that's just rotten luck. If human beings had the same range of infections of cats, we'd all be living with our viruses, whereas most human infections, or many human infections, the viruses are here today and gone tomorrow. And it's only a few of the infected cats that actually suffer from serious disease. And this is a theme that you'll hear me talk about over and over and over again during the course of this presentation. The idea that many, many cats are infected, but only a few suffer from serious disease. Now, you saw the list. If I started to talk about every one of those infections, probably Feline Friends and Webinar Vet will pull the plug on us sometime around 2 o'clock in the morning. you still wouldn't have got through half of them. So I'm going to just focus on the really important infections. And by important, I mean the ones that are very common, that almost every cat owner will have had an experience of if their cats have had any infections, or are particularly serious infections that maybe we need to understand more about in order to try to control them, because these are the ones that turn fatal. And so I've got three groups there: the cat flu group, the retrovirus group, and a little bit at the end about the FIP virus, or the Feline Infectious Peritonitis virus. So those are the three I'm going to talk about. Happy to have a few questions at the end about some of the others if you want to. But those are the three I thought would be most relevant and most important. So let's start with cat flu. My other joy in life besides cats is mountain climbing, and you'll forgive me here that I get to show you some of my favorite shots of mountains around the UK. So cat flu does what it says on the tin, that it causes flu in cats, but it's very important to realize this is not the same as human flu. This is not the influenza virus. This disease is caused by a whole complex of infectious agents, of which two, the feline calicivirus and the feline herpes virus, account for about 85% of all the infections. All the other things that you see listed there have all been recorded in cases of cat flu, and there are probably still other ones that we have yet to discover, but those two comprise about 85% of all known outbreaks of cat flu. And what happens in these outbreaks of cat flu is that the cats generally feel unwell. They've got a temperature, they feel down in the dumps, they have a poor appetite, they sneeze a lot, they have nose and eye discharges. They generally don't cough, and coughing is quite an uncommon sign of cat flu, unless it is caused by one of the other causes like Bordetella. It lasts about 3 weeks. Very, very, very few cats ever die of it, but because of the nature of the viruses involved, they can cause residual damage, which again is a difference to human flu. If you get flu, you are unlikely to be scarred for life, but in cats that can happen. The first of those viruses we want to talk about is herpes virus. And herpes is a big group of viruses. You will have heard of human herpes, of course, but it is a group of viruses that is associated with cat flu and other flu-like symptoms, as well as the other things that you've heard about herpes. Now, in cat herpes, it's a very delicate virus. It's just so easy to kill this virus outside of the cat. But what's important in the biology of this is that the virus can become latent. And by latent, I mean it can hide inside the cat for years, not showing any clinical signs. And then one day it comes out. And it causes cat flu, but particularly it also causes eye problems. And the eye problems that we worry about with feline herpes virus is this: what's called ulcerative keratitis, which is like a big ulcer in the middle of the hard part of the eye, a corneal ulcer. And this is caused by herpes virus, and it can be extremely damaging and can lead to damage to the eye and even loss of the eye at times. And what happens when a cat gets infected with herpes is that it has this acute infection, this cat flu stage, which may lead to chronic damage. And that chronic damage could be the eye, or it could be chronic damage in the nose, leading to chronically dripping noses. And if that doesn't happen, then these cats will undergo recovery and they will look fine. But only a small proportion will actually get rid of the virus. Only about 1 in 5 cats after an infection of herpes never gets herpes again, because 80% the virus goes and hides in the body. First of all, as a carrier, so you can find it in the mouth, but they're not they're not with signs of cat flu, so that's carrier status. And then the virus goes and hides in the nerves of the body, and you can't find it. You can't see it in the nerves of the body. And that latent infection then can be reactivated by things like stress. And when that happens, they become carriers again, and they start shedding virus. And when they're shedding virus in the reactivation, then that can happen like a true cat flu, or it can happen just in the eye. So you can see cats coming in who have just got one of those nasty corneal ulcers, and that is due to herpes. So a cat that is infected with cat flu, which is caused by herpes, is likely to be infected for the rest of its life, and at any time during the stage of its life, it may have a reactivation, and that may lead to eye damage. Now, the other virus we talked about was the Feline virus. This is more variable than the herpes virus, and it's stronger. It's more resistant to disinfectants. It lasts in the environment longer. It can spread more easily between cats. And as a result, it's more common than feline herpes virus. But as a generalization, it's also less serious. And it causes cat flu, but also mouth ulcers, arthritis, and sometimes chronic gum inflammation, which we call gingivitis. These ulcers that you see here in these kittens' mouths have both been caused by Feline virus. And we see this as quite a common finding in kittens with cat flu. Again, like herpes virus, the acute infection can be followed by chronic damage or clinical recovery and a carrier status. But the big difference with Feline virus is that they do not become latent. Those cats can, if they are carriers, you can find the virus in the mouth. And there is a true recovery with about half the cats who come out through Feline virus will actually fully recover from it. And the rest will undergo a shedding of the virus and be a carrier status, which may last a long time. And when it does, then it's called persistent shedding, persistent carrier status. And it varies about what sort of cats you're talking about. So if you're looking at cats who live on their own in a house, then a relatively small number, 8%, may be shedding the virus. Whereas if you look at some colony cats, they can be 40% of those cats can be shedding. And the reason probably is that the viruses in the colonies are circulating around and around and around, and they're getting reinfected. And some of these cats who are living in these big colonies may also be more stressed and therefore more likely to find it difficult to resist the infection. So we have herpes virus and Feline virus. How do we diagnose them? Well, the first thing to say is that you cannot look at a cat and say it has herpes or it has Feline virus. You can look at them and say they've got cat flu. It is important to make the diagnosis of whether it's Feline virus or herpes virus because it's important for the future of that cat and for the control of that infection. But it doesn't actually affect the treatment. And the way a vet will make the diagnosis is to take a swab from the throat and put it into one of these viral transport mediums and send it to a special laboratory. And you need to make sure these go to the proper laboratory, and it must go in the transport medium. It isn't a normal bacterial swab. If you've never seen this done, then it's a fairly simple thing to do. We take the cat and we just rub that swab at the back of the throat fairly quickly and put that swab into the transport medium. It doesn't hurt the cat, although I can't imagine it's particularly pleasant for them. It doesn't hurt them, and we get the results about 1 week later. Whilst we're waiting for those results, we're going to treat the cats for cat flu in the same way that we would treat a human being for flu. with good nursing. So we want to keep the cats indoors. We want to keep them warm. We want to clean their nose of all the snot and so forth. And we want to give them nice food. Now's the time to get out the smoked salmon for your cat. Now's the time to get out that nice tasty bit of chicken to keep them eating. We want to give them fluids, either by mouth, and that may mean syringing chicken juices and so forth, or it may mean, if they're very bad, going into the vet for some fluids into the vein. Because these are caused by viruses, you will not get rid of them with antibiotics, but most cats that have these cat flus will get a secondary bacterial infection. And so in those cases, it is reasonable and sensible to use antibiotics. If the cats have got a big fever, a very high fever, then anti-fever drugs, so-called antipyretics, things like Metacam and Loxicam and so forth, can be used, and that will make the cats feel better for a while. I think it's also worthwhile saying, of course, because it's infectious, these cats should be isolated. They should be isolated from other cats in different households. So these cats should not go into catteries. They should, we try to keep them not in a vet surgery either, because we need to keep them isolated away from uninfected cats, because these are very infectious things. If your cat does develop what's called one of these herpes virus ulcers, then it's really quite a serious situation for that eye. As you can see, this eye in this cat is very badly damaged, and unless we act quickly, we may lose this eye. And as a cat may have more than one reactivation, you really can't afford to be complacent about this. This has to be treated very seriously, very quickly. So the way we treat them, first of all, is with interferons to try to limit the virus. We use antivirals like acyclovir or famciclovir, and some people use lysine. I'm not too convinced that works that well, but it's useful. But above all else, all these drops, the main thing is lubrication. The best solution is the one that goes in most frequently, and keeping that eye lubricated is the most important thing. So typically I will be getting owners to do some sort of drop every 2 hours in that eye, and that means all the way through the night, and it's a hard job for the owners. But the good news is they only need to keep it going for maybe 3 or 4 nights, and then the cat's own eye will heal quite quickly by itself. In addition, sometimes we see secondary infections, and in those cases, we need some antibiotics. So, what does your cat need to know? Want you to know about cat flu? Well, the first thing is, like all flus, the cat will get over it. They won't be well for 2 or 3 weeks. They're not going to be their usual selves, but they will get over it. The second thing that you have to be aware of is that your cat needs you to know what caused it. Because if it was herpes virus, then you have to keep an eye on the eyes of that cat. You can expect the cats to have reactivation if they get stressed, if they go into catteries. And if it's a Calyce virus, then they're going to be excreting the virus for a long time afterwards. And you may need to get repeated virus swabs until you know that your cat is negative before it's safe to mix with other cats. So that's cat flu. What about that feline retroviruses group of viruses? Well, these are 2 viruses, one called Feline Leukemia virus and one called Feline Immunodeficiency virus, and they're both retroviruses. Now, these retroviruses are really quite clever little viruses. They hide away inside cells very quietly. They don't kill the cell, and they use the cell's machinery to make more virus. These retroviruses are considered or were considered really quite common. If you looked at this study from 1989 of retroviruses in sick cats, then 15% of cats with which were sick for all causes of sickness, had FIV, feline immunodeficiency virus, and 14% had feline leukemia virus, and a very few unlucky ones had both. It was considered these were very, very common causes. Now, a lot's happened since 1989. Feline leukemia virus vaccination has come on board. We also have methods now of detecting these viruses much better. And as a result, things have been changing a little. And in 2017, Jenny Stavinsky published from some work done with the RSPCA, showing that in fact, feline leukemia virus was now considered really quite uncommon, and only a very few cats were found with it. And that's also backed up by a study by Westman and others in Australia. So across the world, feline leukemia virus has really become a relatively uncommon infection. Whereas feline immunodeficiency virus is still out there. 11% in one shelter in the UK, 15% in Australia, 14% in the hospitalized cats, 15% in amongst healthy client-owned cats. So there's a lot of cats out there, perhaps 1 in 7, 1 in 8, that have feline immunodeficiency virus. So I'll just tell you quickly about feline leukemia virus. As I said, it is becoming less common. This was the virus that I worked on back in the 1990s when I first started working in Glasgow. It was identified by a guy called Bill Jarrett in 1964. And scientifically, it was huge news because this feline leukemia virus was the first virus that was ever shown to cause cancer in a wild population, as it were, a natural population of animals. And it directly led to the discovery of similar viruses in humans, and indeed the AIDS virus. And it was a seismic shift that started in that household of cats in Glasgow. The thing I want to make sure everyone knows is that many, many, many cats get infected with feline leukemia virus and still get infected with feline leukemia virus, but most of them recover. And what we're seeing is a higher rate of recovery. And it's only those that don't recover from the infection and that become persistently infected, chronically infected cats, those are the ones that develop the problems. So what we see after feline leukemia virus infections is that there is a short-term virus replication in the blood, which usually leads to recovery. A few go on to become persistently viremic. That is to say, they persistently have the virus in the blood, and it's those that develop the feline leukemia virus-related diseases. In the 1980s, however, it became clear that it wasn't that simple, and that actually feline leukemia virus also underwent a so-called latent infection, where the infection was confined in the bone marrow. So although many cats we thought were negative, it actually turns out that the virus is hiding. Now, the good news is most of these go on to recover fine, but a few can be reactivated to become persistently infected in all the organs of the body, and those will develop feline leukemia virus-related diseases. What are those diseases? Well, it's a whole complex of diseases that are caused by feline leukemia virus. It is a very nasty virus if you have it in your body for a long time. Diseases like cancer, leukemia, immunosuppression, kidney problems, other sorts of tumors. Lots and lots and lots of problems. And cats that have this virus for more than 3 or 4 months and go on to become persistently infected, many of them die within 2 or 3 years. It really is a nasty virus. And so early on, we made a lot of effort to make sure that we could recognize these viruses. And now we will have in vets will have these little test cartridges in their practice, which they can use to test for not only feline leukemia virus, but also feline immunodeficiency virus. And if they find a cat that is positive for feline leukemia virus, then if they're healthy otherwise, and there's no problem, then as I said, most of them will get over it. So we isolate the cat in your house. We make sure they're not mixing with other cats in your house, and we retest them 12 weeks, which is 3 months later. And for the most part, these cats will go on to recover from the virus just fine. Any cats that have been in contact with this cat should be vaccinated. If those cats, however, are already sick and already have cancer and already have severe anemia, there is very little that we can do, because even if we can get them over that, then the chances are they'll come down with something else. And so I'm sorry, but some of the cats where we have tumors because they have feline leukemia virus, because they're infectious to other cats, because they won't survive, then performing euthanasia is often the kindest thing to do. And it's a very sad day, but we have to do it. Of course, we don't have to live with feline leukemia virus now. We can vaccinate against it, and many cats are now vaccinated against it. There's lots of different vaccines on the market. Some have some are better than others, but they all work well enough to control the virus and to stop this virus spreading in the population. So what your cat needs to know about feline leukemia virus is vaccinate your cat, particularly when they're young. Cats are more susceptible to the virus when they're young, so vaccinate the kittens. If you vaccinate the kittens, then this is not something that should cause you much bother. If your cat is diagnosed and if the cat is well with it, then you should test the cat twice, 12 weeks apart, because many cats will get rid of the virus. So what about feline immunodeficiency virus? Now, I'm sure you've heard of the human immunodeficiency virus, HIV or AIDS. Well, cats also get something very similar. The AIDS virus in cats was just identified in 1987 on the back of the fact that people recognized human AIDS, and people started to wonder if it happened in cats, and sure enough, they found groups of cats with these infections. And at the time, it was held up that feline immunodeficiency virus, the cat AIDS virus, was a common cause of disease. I put a big question mark there. As you'll see later, I'm not sure that's always true. What I do know is that when cats get AIDS, they do not recover from the infection. They remain infected, just as most human beings do. Cats with AIDS do not get over the infection, but they don't necessarily suffer from disease. Because they are this virus is spread by biting, and because the infection accumulates in the population, so you're more likely to see infections in older cats. And we know that cats that get this infection, the virus moves very slowly. So cats and indeed humans survive many years with this virus, and there's a relatively low mortality rate. As well as biting, there is no other sort of spread of feline AIDS virus. There's no spread by nasal spread. There's no sexual transmission. There's no spread in the milk, so kittens born to mothers who are FIV positive do not become FIV positives themselves, and that's a big difference with humans. So in many ways, it is less infectious than HIV, and the cat lives with the infection rather better. We do see some diseases in FIV-infected cats. They have an increased risk of tumors. They have about a 5-fold increase in risk in tumors. And that might sound like a lot, and it is, but compared to leukemia virus has a 30-fold increase in risk of tumors. So FIV is perhaps not as bad as feline leukemia virus. Cat AIDS will also infect the brain and cause neurological disorders. This is a cat here that has a brain lesions because of feline immunodeficiency virus. They may cause eye lesions and You can see here some cats with infections in the eye. You can see the two eyes are of different dimensions, and this is because this one here has a uveitis. They cause low white blood cells, they cause fevers, and ultimately they may cause wasting. But in humans, it's not the primary disease that causes AIDS people problems, it's the secondary infections. And there are many secondary infections that have been linked with cat AIDS virus. In particular, one which is a chronic gingivitis. But there is a lot of question marks now about whether this has any association at all. And that was because in the early days, when people saw cats with cat AIDS virus, they assumed that every infection that they had was associated with the AIDS virus. And in fact, it turns out this is not the case. So there's a big question mark about what secondary infections we see with the AIDS virus. If we have a cat with the AIDS virus, then we can treat some of those other infections if they're happening. Sometimes it's associated with severe inflammation, so we can give corticosteroids. And we can even use some of the anti-AIDS drugs like AZT and so forth. And ultimately, if cats are too sick and too poorly, then we may not be able to save them. In America, there is an cat AIDS vaccine, but sadly, it's not proven to be protective. That is to say, when a cat is vaccinated and then comes into contact with the AIDS virus, it turns out the vaccine does not work. And that may be because the antibodies that the vaccine creating are actually helping other AIDS viruses getting into the body. In addition, this also interferes with virus testing. So once a cat has been vaccinated, it then looks as if it's infected. And for all these reasons, I don't think it's likely this AIDS vaccine will ever be licensed in the UK or Europe. Just like to bring you up to speed with some recent research on AIDS, though, that has come out of Glasgow, and looking at what happens with groups of cat AIDS infected cats. Pavel Bravosky, who looked at this, looked at a group of cats in Chicago who had the AIDS virus, but were kept in individual households. They were kept inside. They were looked after as a family pet. And 27 cats also infected with the AIDS virus in Memphis. These cats, on the other hand, were all kept together as part of an even larger home of about 60 cats. And what Pavel found was that the cats in Chicago generally stayed well. And indeed, none of that group died. Whereas the cats in Memphis lost weight and died, often of tumors. And what that would tend to suggest is that the way to look after a cat that is infected with cat AIDS is to look after them, is to give them a nice home, is to give them an environment where they're not exposed to other infections, good nutrition, low stress. And in those circumstances, these cats live a normal, happy life. It's the cats that are kept in big cat households where the exposure to other infections, to the stress of living in these big households, these are the ones that tend to suffer from the AIDS. So what your cat wants you to know about the cat AIDS virus is that they can live with it well if they're looked after well. If they do have it, however, they must not fight other cats. They will spread this infection to other cats if they start fighting. And so that may mean for some cats that they have to stay indoors. If they are fighters, they must stay indoors and keep the infection off the streets. That brings us to the last of our serious infections of cats, and that is the infection known as Feline Infectious Peritonitis. This is caused by the feline coronavirus. This is a virus that was first identified in the 1950s, and it looks like it emerged in cats in the 1950s. It wasn't seen before then. This was a new disease. And the equivalent in humans would be the SARS outbreak that you may have heard of a few years ago. That was a coronavirus. These viruses are often difficult to grow in the laboratory. And as a result, some of the studies that are done on the viruses that do grow in the laboratory, which may not be representative of the ones that are actually causing the disease. And what we know is that most coronaviruses just cause diarrhea. The diarrhea may last for 2 to 4 to 6 weeks, but the cat will get over it. Indeed, if your cat has ever had diarrhea for a few weeks, it may be that it had coronavirus and you never knew about it. The problem with coronavirus is that in a small number of cats, for whatever reason, the coronavirus can mutate. And once it mutates, it no longer stays in the intestine causing diarrhea, but spreads into the body. And at that point, it starts to cause inflammation in the body. And with that, it starts to cause damage to the blood cells. Now, that mutation will obviously be more likely if there are more coronaviruses around. So the dose of coronavirus is important, as well as the individual strain. We know that cats that get feline infectious peritonitis have been excreting for this virus for some weeks before the clinical signs. And that's good evidence that this is not something that feline infectious peritonitis spreads cat to cat to cat to cat, but rather coronaviruses spread cat to cat to cat to cat. And then only a few will actually come down with the disease, often after a prolonged period of being infected with the coronavirus. And the cats that are most likely to be susceptible to this cat to cat to cat spread are kittens. Kittens are born with antibodies against their mum's own coronaviruses, but they're not born with antibodies against other adults' coronaviruses. So tends to be kittens from other litters or the parents of other litters that infect the kittens. And so it's when we start mixing litters of kittens, when we start mixing litters of kittens with non-parental adults, that's when we start to see these coronaviruses going from cat to cat to cat to cat and increasing the dose each time. And that results in one poor kitten coming down with feline infectious peritonitis. When a cat is infected with coronavirus, then if the virus replicates in the intestines and the lymph glands, and if the cat gets a low dose, or that strain is not particularly likely to mutate, or the cat itself has good strong immunity, then you won't see any disease. If, on the other hand, the cat has a large dose, or it's a particularly bad strain that is quick to mutate, or it is the cat for some reason has weak immunity, then you can see one or other type of feline infectious peritonitis. And there are two types of feline infectious peritonitis. There are the wet or the dry forms, and we'll just cover what that means. In the wet form, you see a cat that has got inflammation, rapid inflammation throughout the body, and particularly in the linings of the body inside. So the lining of the abdomen is called the peritoneum, and when you get inflammation there, you get a buildup of fluid, and that buildup of fluid is very serious for the cat. It's called ascites. If you get a buildup of fluid in the chest, then you start to have breathing difficulties. That's what we call dyspnea. And these cats with wet FIP rapidly become very ill. They often will die within a matter of a couple of weeks. The other form of feline infectious peritonitis is characterized not by the rapid inflammation of the linings, but rather the slower inflammation that is present elsewhere in the body, so particularly in the liver and the kidneys and the eye and the brain. And these are slow infections that develop with slow inflammation and slow damage. And it can take weeks or months for the cats to develop the clinical signs and ultimately, sadly, to die. Both the wet form and the dry form will have fever, they will have a temperature, they'll lose weight, the cats will become very depressed, and they may have one or other signs of both syndromes. These are not absolutely exclusive to individual cats. Some cats can have some signs of wet and some signs of dry. Sadly, most or 99.99% of cats that develop FIP will die of FIP. If that virus has mutated and gone into the cat, then there is nothing the cat very much can do about it, or anything the vets can do about it at the moment. And as a result, those cats will tend to die. Because it's a thing that happens when cats are infected as kittens by other kittens and infected by non-parental adults, this is generally an infection that is seen in young cats, generally less than 2 years old. Most of the cases that I've seen of this have been under 1 year old indeed. And it's very, very tragic when this happens, because these are young, healthy kittens who then develop this fatal infection. And there's not much we can do about it. It can look like other diseases. It can look like liver diseases. It can look like kidney diseases. It can look like other things that cause fluid in the abdomen. It can look like brain diseases. So FIP can look like other things, and some of these can be treated or at least managed. So diagnosing FIP is very important. It's important we make the diagnosis, because if we think it is FIP, then we know that the cat is likely to die of it, and therefore we need to look after it as best we can. Now, in diagnosing FIP, the only real way of diagnosing it is to take a biopsy of the kidney and to look at that under a microscope. The problem is, of course, that cats are often very sick, and this is a very invasive thing to do to a cat. To take kidney biopsies and so forth is a nasty thing to do to a cat. So we now talk about the diagnosis of FI being presumptive, which is based on us demonstrating that there is a virus there are compatible history and clinical signs, there's compatible inflammation, and that there's often, if there's any fluid, that there's the right sort of cytology. And we put all of these together and we say this is a presumptive FIP. If we can get a kidney biopsy and look at it under the microscope using special stains called immunohistopathology, then we can diagnose definitely got FIP. But that requires a biopsy, and that requires an anesthetic, and it's not easy for cats to go through this or for vets to do it safely. But it remains the only definitive way is to look at the examination of a biopsy specimen underneath the microscope and to show that there is a coronavirus there. And so I would encourage you that if you think your cat has got FIP, whilst it may seem cruel, you need to know it is FIP and you need to have that biopsy done, because then you can make the right decisions for your cat. If you don't know, then you may be persuaded to give up too soon, and you may miss a treatable condition. If a cat is definitively diagnosed as FIP, I'm afraid there is no hope. And because there is no hope, we shouldn't be trying things that we know don't work. If the cat is suffering, it's simply not fair to go around experimenting on cats with things that we know don't work. If the cat isn't suffering at the time, and the early stages of dry FIP, the cat may not be suffering that much, then we can try things like steroids and interferons and antibiotics and nursing. And some of them will improve for a while. But sadly, if they do have FIP, the vast majority of them will go on to die. Really exciting news just released in the last couple of months or so is the idea that using other antivirals may hold promise. Now, there is so far only one paper out there, and the person who did it used a drug that is not available anywhere. It's an experimental drug. And until it is available somewhere, then I'm afraid we can't really do much. But it does show us that there is some hope. The death rate still is quite high, but with the antivirals, they can survive for a while, and many of them can go on to recover. Whereas without the antivirals, most of them will die. In America, again, they've got a vaccine, but again, like the FIV vaccine, it is a problem because it does not seem to be protective. And as a result, cats that are vaccinated may actually be more susceptible to the disease, not less. So the best option, at least in the United Kingdom, is to keep young kittens and non-parental adults apart. So if you've got one litter and another litter, don't mix them. Don't mix mothers from one litter with kittens from another litter. Keep them apart. And then if that prevents the spread, and then the only other thing one can do, if your cats do not go outside, is to identify those cats that have the coronaviruses and keep them separately from the cats that do, and that will protect your cat as well. But it is very hard to do that effectively because coronaviruses do spread very easily. So what does your cat need you to know about feline infectious peritonitis? Well, first of all, for kittens, keep me with my mum and away from other adults and other kittens when I'm a kitten. Once I'm old enough, I can leave mum's side and go out there, but I still do not want to mix with other kittens until I'm over 6 or 7 months old. If I do get sick and a vet starts mentioning FIP, then it's important that the FIP is properly diagnosed before we go and start making really very serious decisions. So today I've covered 3 sets of infections, cat flu, and the importance of good nursing in the treatment, the importance of the difference between Feline virus and Herpes virus, and making sure that we know which one our cat has. I've talked a bit about the retroviruses. Feline Leukemia virus, relatively uncommon now, is seen in young, friendly cats because it's spread quickly in small numbers, in small households. And FIV is seen as a disease of old enemies, cats that fight each other. These retroviruses are still locally important. Feline leukemia virus and FIV, if your cat has it, it's a serious issue. And there are vaccination issues with the cat AIDS, of course. Feline infectious peritonitis is difficult to diagnose, but there is good news on the horizon because there is a small ray of hope for the treatment of this virus in the years to come. It's probably going to be about 5 years before we start to see an effective treatment come out, but I am more confident than I've been in 25 years that we may now start to see treatments for feline infectious peritonitis come out. So thank you very much for listening. I hope you learned something from that about feline infections. And now I'd be happy to take any questions that anyone has for me.
Thank you very much, Ian. Really, really informative talk as always. So we do have a couple of questions through already. So the first one, is it possible that a cat can get cat flu after having his flu jab?
Yes, sadly. Cats can get cat flu after having a flu jab for one of two reasons. The first is that they were infected with the herpes virus before they were vaccinated. Vaccination doesn't stop that herpes virus coming out again in the future. And the second thing that can happen is that because there are many different strains of the Feline virus, that maybe your cat vaccine doesn't cover a strain that your cat is exposed to. There are now cat vaccines out there which cover more strains of Feline virus, but they still don't cover them all. So there is always still a possibility. So yes, please get your cats vaccinated against cat flu, but it never is an absolute guarantee.
Excellent. And the next one, can we vaccinate FELV positive cats for the disease to reduce clinical signs or progression?
Sure, thanks. That's a good question. The honest answer is that has never actually been shown. Our hunch is that vaccinating infected cats does not help, but no one's ever actually shown that, as it were. But I still think it probably is not going to work. They already have lots of antibodies, they just don't work.
Excellent. And there's two parts to this next question. So FIV infection cannot occur by sharing food or water bowls. That's one question. And even if FIV negative cats have gingivitis and cohabitate with FIV positive cats.
Can't occur can't is a very strong word. Is very unlikely to occur. There are many households where there is one infected cat and 4 uninfected cats. And so I'm fairly confident. The problem is that, of course, cats that share a household are more likely to fight. Even if it's only play fighting, then that's how it could spread. So a cat that shares its household with another cat that has FIV is more likely to be positive than a cat that doesn't share its household, but it's not guaranteed. Whereas feline leukemia virus, if one cat in the household has it, other cats in the household almost certainly will have been infected. Even if they've got over that infection, they will have been infected sometime in their lives. It's very infectious, is feline leukemia virus.
Lovely, thank you very much. And is FIP considered infectious, or just the individual viral mutation can induce the disease?
I do not consider FIP infectious. I consider coronaviruses very infectious. But a cat that has FIP will not spread FIP to the next cat necessarily, but they will spread coronaviruses to the next cat. And if the strain they have is one that mutates readily, then it's quite possible that it will mutate readily in the next cat that it comes across. So it's kind of splitting hairs, but I generally tell people whose cat has got feline infectious peritonitis that it is not infectious to the next cat.
Okay, and how can you tell if it's FIV based on histopathology, a special ink, or immunohistochemistry?
Well, you wouldn't use FIV on the basis of histopathology. FIP you diagnose on the basis of histopathology. FIP you diagnose on histopathology, and we have antibodies that will bind to the coronavirus on microscope slides. And you can attach markers to those antibodies, and then when you look at the slides, you can see that those cats have coronaviruses in the middle of their lesions.
Okay, and then somebody is asking about their own cats. I have twin Bimans, aged 4 years old. They're totally indoors. They've had all their own vaccinations, but my vet vaccine says he thinks.
I'm reading it as well. I'm not actually sure. I also should say is that I'm quite happy to talk about general viruses, but specific questions on your own cats, particularly where you're talking about your own own vet's been involved, I'm happy to take a conversation with your vet, but obviously they know what's going on, and I need to speak to your vet.
Okay, fair enough. And the next one, do I need to vaccinate older cats for FELV if they've always been vaccinated?
Oh, that's a good one. That's a very good one. Should we vaccinate feline leukemia, older cats against feline leukemia virus? No harm. There's no harm in doing this. But do you need to do it? We know that there is a very strong age-related resistance against feline leukemia virus. So over 3 years old, you just don't really see infection in cats with feline leukemia virus, except very, very rarely. So for me, my cats, once they went over 3, I don't vaccinate against leukemia virus. But, with the caveat to that is, I would vaccinate them again if I was getting a new kitten into the household, because the new kitten might bring feline leukemia virus with them. And in that case, you might want to vaccinate the older cat. But apart from that, I sometimes despair a little about the use of these vaccines in 10-year-old cats, because these cats are very solidly immune by that stage. Of course, that's not true for the cat flu vaccines, so they should carry on getting the cat flu vaccines.
Okay. And do you advise that indoor cats need vaccinations even if they've had all the other vaccines and they're healthy?
If you have an absolutely indoor cat that never ever goes outside, you never bring that cat. No other cats come into the household, and they never go outside, then there is no way that infections can get into your household except on a cat. Yes, the only exception, the only virus that can be carried into your household on your shoes would be the parvovirus of cats. I haven't talked about that, the panleukopenia virus. But if they've ever had a vaccine against panleukopenia virus, they're protected. So as long as they're vaccinated once, and as long as you can assure me that no cat comes in and no cat goes out, then you are covered, yes.
Okay. And in cats that have some herpes virus latent that activates once in a while in the eye, is it contagious?
Yes. Yes. When you have those eye lesions in these cats, they have herpes in them, so they are infectious. Sometimes they will even have herpes in their mouths as well, and will be coughing and sneezing and all the rest. So I would regard the herpes as being active and therefore infectious.
Okay, lovely. And a change from the question earlier on, how can you tell if it's FIP based on histopathology? Is it immunohistochemistry or a special ink?
Yeah, well, I said it's immunohistochemistry.
Okay.
I did answer that.
Okay. And that seems to be all of the questions. I've just had a couple of comments just to say what a great webinar it was, and thank you very much, Ian. I'd like to thank all of our listeners for logging on and taking the time to listen to Ian's webinar tonight. And also thank you to Feline Friends for sponsoring tonight's webinar. And finally, thank you very much, Ian. Really, really great talk as always. And I hope you can enjoy the rest of your evening.